According to the Center for Evidence-Based Medicine, CEBM, one of the fundamental skills required for practicing evidence-based medicine is the asking of well-built clinical questions. An evidence will emerge basis a well-structured clinical trial design. Randomized controlled trials utilizing hard clinical endpoints are advocated as the most efficient and reliable way to directly assess the benefits and harms of a therapy. In this era of evidence-based medicine, PECOS process is one of the techniques used in evidence-based practice to frame and answer a clinical or healthcare-related question. Heritage trial by Mylan Trastuzumab MYL14010 meets all the PECOS parameters. P. Patients or populations. Most sensitive and homogeneous. HER2 positive metastatic breast cancer patients eligible for first line of therapy were enrolled in this trial. I. Interventions. Trastuzumab plus taxane. C. Comparison group or gold standard or standard of care. Mylan Trastuzumab was compared to reference Trastuzumab to show equivalence. O. Outcomes of interest. The outcomes monitored were overall responsive rate, progression-free survival for efficacy along with safety and immunogenicity. These endpoints were found to be similar to the reference Trastuzumab. S. Study design. Multicenter, randomized controlled, double-blind clinical study. The pyramid of evidence represents a general hierarchy of preferred clinical study designs. As one moves up the pyramid, the potential for bias is reduced. The Heritage study, which proved equivalence of MYL14010 versus the reference Trastuzumab, fits at the top of the evidence pyramid. You can be confident that you are using a well-researched Mylan Trastuzumab for your patients.